Hi, good morning, everyone. Today we have Dr. Lim again, as he will be our coming webinar's guest speaker on this coming Thursday. So the topic that we're going to talk about regarding on the webinars is my contact lenses are making my eyes red. So as those who have actually joined us in our live sessions or have actually seen our live session, for the past two sessions, Dr. Lim did share about the types of contact lenses as well as what are the complications, right, Dr. Lim?
Yes, that's right.
That will actually cause the redness. So, Dr. Lim, today we're going to talk about like what are the common causes, what are the common problems that is related with contact lens users that usually you will encounter seeing in the center.
Okay, yes, I do see a fair bit of contact lens related problems. Offhand, I would say the most common ones would be related to dry eyes.
Dry eyes.
Yes, dry eyes, and then occasionally sometimes you do get a very bad infection, but majority of cases will be dry eye related, I would say.
I see. Okay, so usually these dry eyes problems or dry eye symptoms, it can actually be resolved by using artificial tears, right? You did share with us the other day.
That's right.
So beside this, is there any like further, because I remember you mentioned about like corneal ulcers, will this be like permanent scarring, or or will it actually resolve, and can they actually put on the contact lenses back again after when they recover?
Okay, this severe dry eyes usually will result in just corneal erosions. That means maybe the superficial cells on the surface of cornea, because of severe dryness, lack of oxygen, they kind of like flake off and get eroded. So the cornea has got many like raw areas. Now, if it's just a corneal erosion like this, usually if you stop the contact lens wear and then you lubricate properly, the condition will resolve without any permanent scarring. Unlike a corneal infection, where even after resolution of the infection, a scar will be left behind, which permanently obscures the vision.
I see. So my next condition, that means just now you mentioned it will not like have permanent scarring if it resolved earlier, right?
Yes, that's
but
right.
Would any of these kind of complications or cases would be more serious than that?
Well, of course, as I mentioned, occasionally you do get something more serious than just dry eyes. But the predisposing, or I would say the cause for these serious infections is actually the underlying dry eyes. Because when the eyes are very dry, especially due to contact lens wear, there will be erosions on the surface of the eye, as I mentioned. And these erosions, they are actually raw areas which will allow bacteria to actually invade or infect your cornea. So once this happens, you'll get something called a corneal ulcer, which is will result in some permanent damage to the cornea. So even after infection has healed, you can expect a scar to be left behind. And if the scar is big or if the scar is central in location, then you can expect some amount of permanent blurring of vision.
I see. So, but Dr. Lim, you will elaborate a bit more, right, during the webinars on this time. Yes. You will show us some pictures because we will not be able to visualize how it will be,
Yes,
so,
that's right.
Okay. So for those who wants to know a bit more, you should join us on our webinar on this coming Thursday. Dr. Lim, if let's say there's a patient who is not suitable wearing contact lenses for some reasons, but they want to be glasses free, would there be any other options available?
Okay, if the patient for some reason or other is really not suitable for contact lens use and they desire to be glasses free, I would say the solution would be actually to do something called LASIK. LASIK is actually photorefractive surgery. Okay, and LASIK also is may not be suitable for some patients. Maybe because of the so-called the eye power being too high. In such cases, then there is also another option apart from LASIK if you want to be glasses free. That is actually implantation of these intraocular lenses in the eye. It's called a phakic IOL actually.
Okay. So all this will actually also based on suitability,
Yes, of course. Everything must be based on suitability.
And we have to come in for a full assessment.
Yes, definitely.
To deem the suitability. So, but is this kind of procedure is safe?
Okay, let's talk about LASIK first. Yes, I do get many patients coming in and they have like so-called like worries about LASIK because they've heard, they've heard people saying or talking about side effects and all. Well, actually, yes. I would say like a few years back when the technology was a bit different, that time it's possible that there could be having more complications. But nowadays, with the advancement in technology and all, I would say that LASIK is a very safe procedure, and this is just, it's not just what I'm saying, it's actually evidence-based studies and all that. And yeah, I would say yes, nowadays it's definitely very, very safe.
I think the evolution of the medical technology has evolved until to this point where it's the precisions and the accuracy is actually higher, right, Dr. Lim?
Yes, nowadays actually the LASIK procedure is, I would say, it's like more than 90% is like computerized, So the margin for like human error and all is actually very, very low. Unlike last time, last time when they made the flap, the LASIK flap, they actually had to cut it by hand using a kind of instrument. But nowadays, even the creation of the LASIK flap is done by a computer and by laser.
As what we have in our center is actually a comprehensive, a complete system, whereby the measurements and the investigations was measured in this machine and is actually connected into the network, right?
Yes.
So all the readings and the investigation will all be transmitted into this private network within this LASIK suite. So the accuracy would be even more precise, right?
Yes, definitely.
So for Dr. Lim, for those who have this concern about doing LASIK, and then I believe this procedure is a very fast procedure only, right?
Yes, the procedure is actually very fast. The time that the laser actually works on the eye is actually can be counted in terms of seconds or maybe not more than a minute.
Oh, so fast.
Yes,
that's
it's a very fast procedure.
But will the patient encounter any pain?
Pain, not really. Maybe sometimes some patients may feel a bit of discomfort during certain parts of the surgery. But that's very rare. On the whole, I would say that most patients they don't complain of any kind of pain or discomfort during the surgery.
So there is a variety of options for those who are wearing glasses or contact lenses. If you want to be glasses free lah. But in this topic, we are actually going to discuss more and regarding about contact lenses. So join us in our upcoming webinar this coming Thursday. Click the link if you have not done the registration. You can join in our Zoom session whereby you can have a direct interaction during the Q&A with Dr. Lim, which is like an open clinic. You can ask anything related with the contact lens issues or the topic that we discussed or any other matters related with eyes. So you can have direct interactions with Dr. Lim during the Q&A. For those who, otherwise you can also join us in our YouTube or our Facebook live session on the same day as well. It will be at 8:30 on the 20th of May. So thank you, everyone. Thank you, Dr. Lim.
Thank you
for your
Bye-bye.
sharing. So we'll see you on Thursday again.
Okay,
Thank you.